Hi, it's Dr. Andy with your daily COVID-19 tip today, and this is tip number 7. And the tip today is to know how a mask or a face covering works. So I don't understand. I know that this is a kind of a hot topic and sort of a passionate topic, and I don't understand all the reasons for that. And I think that's okay. I think I understand some of it, but what I want to talk about is sort of the science then, and just the understanding that I hope addresses some of the concerns and some of the questions that come up about this. So there are some that feel like, hey, this is one of those areas where they say, science, what's the deal? They said a couple months ago, don't use masks, and now they say, yes, you should, but use a face covering. And it's because, again, of some of the science, some of the data that came forward and helped us to see that, wow, people are spreading this disease without having symptoms. And that was really the key. So the principles about using a mask or face covering haven't actually changed. And the principle is that the time you use it is for source control primarily. So it's mostly to block, that means the source of the disease, to block the disease from a source to get to other people. Not to protect the wearer, but to block it from going outward. And so, and this principle has been used for a long time. So for example, in surgery, surgeons wear a surgical mask, and that's to stop them from infecting the sterile environment through a cough or a sneeze, or if they are ill or something of that nature. Obviously, normally you wouldn't operate if you're ill, but that's to add that extra protection because this is a sterile environment, opening someone up. You don't want to leave any bugs in there, right? So that's how it's used as source control. We've used it in healthcare that way. Someone comes in, they're sick, you put a mask on them if they're coughing or something of that nature. That's not a new concept. The new side is to ask the general public to use it. And so this is why. So again, it makes sense. If someone's sick, you give them the mask, and that will block that from getting, this is the sick person, they're red. Since there's red in their face, that means they have symptoms, okay? Blocks them from getting it. Same concept here. This is someone who's sick but doesn't have symptoms. And so we want to do the same thing. Now, since they don't know that they're sick because they don't have symptoms, the only way to do that is to ask everybody to wear a mask. Recommend that everyone wear a mask, and that way they'll all protect each other. The only one that really has to wear it is the one that's sick, but they don't know that they're the one that's sick. That's kind of the point. So until the disease is contained or there's good control measures in place, it's a very strong public health system with contact tracing, testing going on to make sure that we're pretty confident about where the disease is and we can control it and contain it. Until that happens, this is one of the strategies that can be used to help contain it. And it's worked very well in some countries to keep their numbers down, their incidence down. Now, one question that kind of comes up with this, there are many questions that can. I want to try to address two. And the first one is, there's some that have said, well, World Health Organization and other places has said that we don't have documented asymptomatic spread. I've seen that. This claim and this discussed. And the key here is there's a difference when we talk about asymptomatic versus pre-symptomatic. Asymptomatic, when you're talking about it in epidemiological literature with this disease, means no symptoms ever. And pre-symptomatic means no symptoms yet. Now, while it's very hard to prove whether this group, asymptomatic, can spread it. It can be hard to prove that the study has to be timed just about perfectly to be able to prove that. So that's hard to prove. Pre-symptomatic, we know that those people spread it. We got lots of evidence, lots of case studies, lots of cluster investigation reports that show that pre-symptomatic people spread it for 1 to 2 days before they get their symptoms. So we know that happens. So we know people without symptoms spread it, whether you want to call them asymptomatic because they don't have symptoms, or be more specific and call them pre-symptomatic, they spread it. So that's one thing. The other thing is people talk about, well, what does this need to block? If this person's not coughing or sneezing, the thing is, we're blocking droplets. And there's discussion about, well, it doesn't block all the viral particles. That's true, it doesn't. But we mostly want to block the droplets because the epidemiology shows that that's how it seems to be spreading, is through droplets. And we call them respiratory droplets. And those come through coughs, yes, through sneezes, yes, but they could potentially come from talking, and especially if you're talking loudly. and also from activities like singing, and there are other medical procedures that could do this. And so anything that gets get a lot of air to come up and to kind of force it out again, talking loudly, singing, potentially could spread it. Now, again, since it's tied to the respiratory droplets, it probably will just go for a few feet, and so that's why we have that 6-foot barrier recommendation, and then it seems to settle fairly quickly. And so that's the primary way this spreads and our biggest concern, and why we say we're really at a population level. Everybody should kind of have this concern, these precautionary measures, until we get this more under control. That is tip number 7. Know how a mask works, or a face covering.